Okay, hello everybody. It's Dr. Rosenfield here at the Pearl Women's Center. It is a Tuesday afternoon, and I am sitting here with two of our providers at the office. I've got on my left Jade Carboy, who is a nurse practitioner that we've recently welcomed to the practice, and to my right is Erin Conlon, who's a naturopathic physician. We thought we'd take a minute with our masks on because we're super conscious about the social distancing, just to talk a little bit about what we all do in the practice. So you've seen many videos with me, so I'm going to hand it off, first of all, to Dr. Conlon to introduce herself and her practice, and then to Jade over here to my left. So why don't you take it away, Erin?
So, like Dr. Rosenfeld said, I am a naturopathic physician. I completed 4 years of medical training, of medical school here in Portland, Oregon, followed by 3 years of residency. And my residency was focused in women's health, where I spent quite a bit of time split between a variety of different locations. So primary care, naturopathic medicine, and conventional clinics, where I spent time with infertility, conventional gynecology, and urogynecology as well.
So you do annual exams.
Annuals, I
Love working.
IUDs.
What's that?
IUDs.
IUD placement, contraceptive management, total expert with hormone replacement therapy as well, right?
And so perimenopause, menopause.
Yeah, and a goal at really helping our patients find wellness and health. And so, how about you, Jade? Why don't you give a little background of where you started, where you've been, and what you love to do?
Sure. So I am a nurse practitioner. I dual specialized in both women's health and adult dermatological primary care. So my background in nursing was in emergency care, and then I moved on and did my first few years as a nurse practitioner in primary care prior to going in and specializing a little bit more in just women's health in general, which is really my passion.
Awesome.
So,
and I also understand that you're going to be doing some sclerotherapy here, which is awesome. So we do the varicose vein ablations. Sclerotherapy is for those little spider vessels that we see. That it's more of a cosmetic thing, but it's something that we can offer. And speaking of cosmetic work, you also have done some work with Botox and fillers.
Sure, yes, I have.
So it's really cool that we're going to be adding that stuff to the practice. What about like polycystic ovarian syndrome? How do you guys, maybe just give me a few sentences on how you like to approach things like PCO and hormone balancing, maybe not in the menopausal patient, but in a younger patient?
Yeah, PCO is quite common, unfortunately. And I like to really take a step back and recognize that a woman is much more than just her female parts. So we like to really do screening labs, see what's going on. We like to think of how you are right now and what might happen down the line. So preventive care, especially in women with PCO.
Right. Now, Jade, we were talking before about one of the certifications that you have in hormonal management that was using subdermal hormone pellets, right?
Correct.
Can you talk a little bit about that? Because this was something that was new to me that's really exciting. And are you certified in that as well? Or
I don't use pellets.
This is definitely going to be more for Jade to answer. So why don't you talk a little bit about that?
Yeah, so what we're talking about is BioT, and basically it's hormone replacement therapy, but through small pellets about the size of a grain of rice that we place under the skin, kind of on the bottom or the hip. We do this about every 4 months, depending on the person and the metabolism. It's just one mode of delivery. You know, there's among many modes of delivery for hormone replacement therapy.
So why would a patient want to go that direction as opposed to what I was trained to do, which is just write a prescription, kind of one size fits all for all women?
Well, you know, convenience is a big piece of this. You know, every woman's different, depending on what's going on in their life, depending on their absorption, how they absorb the hormones that we give to them. Sometimes they start with other options that are daily dosing, and they find this to be a little bit tedious and having to remember every single day. So the benefit of BioT is that it's placed, and then you don't have to worry about it kind of out of sight, out of mind until your next visit when you have it placed again in about 4 months.
So with the BioT, then you would first do a consultation with the patient, maybe even telehealth, and then do you need to order the pellet, or is that something that we'll have in stock here?
That's something we'll have in stock. So usually I'll have a visit with the patient, kind of get an idea of their goals, what they're struggling with, do a very comprehensive lab evaluation, and see if they are a good candidate for BioT and make sure it's safe for them, and then go from there. And the next visit, once we've seen labs and everything looks good, we can go ahead and do placement.
That's so cool. Now, what about the naturopathic approach to hormones? Are there, for women that either shouldn't take prescription hormones because of a history of breast cancer, or ones that are just looking for a different approach? How do you approach that, Erin?
Yeah, I usually like to kind of think about 3 different buckets when I'm talking about treatment for menopause or perimenopausal symptoms. In one hand, we've got some evidence-based medicine around which specific herbs can be used, herbs and supplements.
Okay.
And then there are non-hormonal prescriptions and then the hormonal prescriptions. And really, when you're talking to any woman who's in this perimenopausal or menopausal time, we take into account her personal history, her desires, her family history, and the bigger, broader picture, and then make decisions together, talking about risks and benefits.
Where would a patient get herbs then? Do you write a prescription for that? Is that something that we send a patient to a compounder?
Just for the folks particular about where we get herbs, because it really matters how something is grown and something's processed and developed into a final product. So I give a lot of education and direction on.
So just like we all care about our groceries and what we put in our bodies that way, it would make sense that where we get our herbs isn't as simple as just going to a big grocery store or a big vitamin shop and picking something off the shelf.
Exactly.
Perfect. Well, that's great. Well, listen, we are here to answer your questions. So if you have questions about what we do, please email us at info@Pearl Women's Center. We have appointments available because we have these new amazing providers at the office that have both recently started. Erin's been with us for about 6 months and Jade's been with us for just a few weeks. So we're very excited to take care of the women of Portland and regionally as well. And if you have any questions, please reach out to us. We would love to see you downtown at the Pearl Women's Center. And hopefully soon we're going to have far more light in the office because we're going to take these boards off of our windows and start pretending like we live in the Pearl District. It used to be the greatest place in Portland. It has changed a little bit, but we're hoping to see it get back. Thank you both. This is great. We're going to push this out on the internet, see what happens.